Baldness, early age problem. Here are the main causes and ways to avoid it. Early baldness is a problem that affects young men and women in their teens or 20s. It may be caused by genetics, but the most important thing is that there are many other causes that lead to its occurrence and that are treatable. Early treatment of this condition is very important. The longer treatment is delayed, the more complex and dangerous the problem becomes. What is hair loss? We'll start with a quick introduction to natural hair growth to better understand the condition. Hair grow. Hair grows everywhere on human skin except for places like the palms of our hands, the soles of our feet, and our eyelids, but many hairs are so thin that they are almost invisible. Hair is made of a protein called keratin, which is produced in hair follicles in the outer layer of the skin. As the follicles produce new hair cells, the old cells are pushed across the surface of the skin at a rate of about 6 inches per year. The hair you see is actually a series of dead keratin cells. The average adult has 100,000 to 150,000 hairs and loses up to 100 hairs per day. Finding a few hairs on your hairbrush is not necessarily a cause for concern. Each hair follicle has its own life cycle that can be affected by age, disease, and a variety of other factors. This life cycle is divided into 3 phases. Anagen active hair growth. The active hair growth phase is the growth phase of the hair follicle, as the cells in the hair root divide rapidly, forming new hair that rushes through and eventually exits the follicle. During this stage of hair growth, hair grows about 1 centimeter every 28 days, and at any time about 80 to 90% of head hair is in the active growth stage. It generally lasts between 2 to 8 years. Catechin transitional hair growth. At this stage, the blood supply to the hair is cut off and its growth stops, and the outer covering of the hair root shrinks and sticks to the root, thus forming what is known as the pupal hair. This stage lasts from 2 to 3 weeks. Telogen resting phase. Where about 6 to 8% of the hair is in this stage, which lasts about 2 to 3 months. At the end of the resting phase, the hair falls out and is replaced by a new hair, and the growth cycle begins again. As people get older, their rate of hair growth slows down. What is premature hair loss? If you're in your early life like your teens or early 20s, and you're losing a large amount of hair every day, it could be early baldness. Hair thinning is the first stage of early baldness, and that's when you lose hair strands quickly, and your scalp becomes more visible in between your hair strands. Reports indicate that the majority of people who experience severe hair loss are in their mid-20s. In a normal state, it takes 6 months for your hair follicles to rejuvenate and form new hair strands. For several reasons, sometimes your hair loss increases and regeneration stops. Here the baldness begins. If premature baldness is diagnosed at an early stage, hair loss can be reversed. What are the causes of premature baldness? There are many reasons why a young man suffers from hair loss. We will mention the most important ones. Eating disorders, such as anorexia or bulimia. Surgery. Excessive use of styling products such as waxes, dyes, and gels. Restrictive diets are diets that do not provide enough protein or iron. Childbirth, which can affect hair as well. Autoimmune diseases such as lupus. High temperature. Infection. Telogen effluvium, or sudden stress-related hair loss. Thyroid disorders. Trichotillomania. Birth control pills can also sometimes lead to hair thinning if a woman already has a genetic predisposition to hormonal hair loss. Early hair loss symptoms. Hair loss can appear in many different ways, depending on the cause. It can happen suddenly or gradually and affect your scalp or your entire body. Signs and symptoms of hair loss may include gradual loss of hair at the top of the head. This is the most common type of hair loss, affecting people as they age. In men, hair often begins to recede at the hairline on the forehead. Women usually have widening in part of the floor of the head. The most common pattern of hair loss in older women is the receding midline of the hair. Circular or patchy bald spots. Some people lose hair in circular or patchy bald patches on the scalp, beard or eyebrows, and your skin may be itchy or sore before the hair loss. Sudden hair loss. Physical or emotional trauma can cause hair to fall out. Handfuls of hair may fall out when brushing, washing, or even pulling your hair gently. This type of hair loss usually causes general hair thinning, but it is temporary. Whole body hair loss. Certain medical conditions and treatments, such as chemotherapy for cancer, can cause hair loss all over the body, and hair usually grows back. Patches of scales on the scalp. This is a sign of ringworm, which may be accompanied by broken hair, redness, swelling, and sometimes oozing. Is there a way to slow down or prevent baldness once you notice hair loss? Whether or not hair loss can be stopped depends on your doctor's diagnosis. In certain conditions, such as hormonal or familial hair loss, treatments can be expected to stop the progression of hair loss or regrow some, but not all, of the hair that is usually lost. When hair loss is due to an underlying medical condition, such as thyroid disease, iron deficiency, or anemia, the hair will grow back when the condition is treated. In conditions such as telogen effluvium, a sudden type of hair loss that usually occurs 3 months after a stressful event or illness, the hair loss is completely reversible without any treatment. Unfortunately, there are some types of hair loss in which the follicles scar or close, and hair is no longer able to grow back in those areas. In these cases, the goal of treatment is to prevent further scarring and preserve only the remaining hair. Is it safe to wear hats, blow dry your hair, or wash your hair every day if you notice your hair is thinning? In most types of hair loss, routine practices such as daily washing, blow drying, and wearing hats should not exacerbate the loss. In some cases, especially cicatricial alopecia, you should limit the use of harsh styling products, chemical relaxers, heat, and tight braids or elastics. What can I do to help reduce hair loss? Over-the-counter diet and supplements can help some patients with hair loss. Doses of 3 to 5 milligrams per day are recommended. Taking a daily multivitamin will also ensure that the body has all the nutrients it needs for hair growth as well. You can also try minoxidil, an over-the-counter product recommended by dermatologists for hair loss. This can reduce hair loss and increase the rate of hair growth. Using a medicated anti-dandruff shampoo will also ensure that there is a healthy environment on the scalp for hair regrowth. The most important thing is to see a dermatologist as soon as you notice more hair loss than usual or hair thinning for the first time. Starting treatment as soon as possible is critical, but many people wait until their hair loss is severely advanced to get treatment, at which point treatment unfortunately becomes more difficult. How do I know what type of hair loss I'm experiencing? The type of hair loss a person experiences is determined by the affected area of the scalp, if the hair is coming out at the root or breaking in the middle, and if the hair loss is reversible. A certified dermatologist can diagnose the type of hair loss through an examination, and a scalp biopsy can be done to clarify and confirm. Precautions and tips to reduce early baldness. Do not ignore the signs of early baldness. If you notice any symptoms, see your doctor, as early-stage medication will help you treat the condition more effectively. Try to avoid styling tools and heating as much as possible. Replace it with natural products, avoid chemical hair care products, and choose hair care products that are suitable for your hair. Keep your general health under control. Underlying diseases such as the thyroid gland or many autoimmune diseases are the main causes of hair loss as mentioned. Pay attention to the medications you take. If you are taking certain medications and notice sudden hair loss, consult your doctor. It could be a side effect of the medication. Your doctor will provide an alternative medication.